today?
I'm well, how are you?
I'm good.
Good.
I'm Lindsay Lohan. I am a physical therapy assistant student. And can I have you verify your name and your birthday for me?
Yeah, I'm Chuck Norris, 2/19/1945.
Awesome. And before we can start treatment, can I get your consent to treat you?
Yeah, of course.
Thank you. Alright, so I saw on your record that you came in for back pain today, is that true?
Yeah.
Alright, so is it mainly lower back or is it... Okay.
Yeah, it's lower back.
Alright, and have you been in a lot of pain this week?
A little bit. Not
Little
too
bit?
bad, but yeah.
Okay, and on a scale of 1 to 10, 1 being the least amount of pain and 10 being the most amount of pain, what is your pain number today?
Today it's just like a 2.
A 2?
Yeah.
Awesome. Okay, so we'll go forward with the treatment. So we're going to go over a couple things. First, we're going to do what's called the neutral pelvic. So, I'll come sit next to you.
Okay.
Alright, so first I want you to touch the front of your hip. Can you feel that bone?
Got it.
Alright, and in the back, can you feel the bones in the back?
Mm-hmm.
Awesome. Okay, so if you want to puff your chest out, you can feel your pelvic rotating,
Oh, yeah.
right?
Oh, yeah.
Alright, now scrunch your stomach, roll back. Can you feel it rotating back? Alright. So neutral pelvis is when you're going to find happy medium right in between. So if you want to rotate back and forth and try to find in between where it's comfortable.
Got it.
Got it? Alright, so through these exercises you're going to want to keep the neutral pelvis. The next thing we're going to do is learn how to keep our back straight while doing a squat. So taking this cane, we're going to hold it one hand above our head, above our shoulder, and the other hand on our lower back. And most people, when they bend over, it's going to go like that.
Yeah, that's what I do.
Yeah, okay. So we're going to correct that today. So the goal is to keep your lower hand on your back as you squat. The main flexion is going to be in your hip and your knees. So as you go down, you're just going to keep your...
Are your knees supposed to pop like that?
It's not good, but mine do.
Okay.
Alright, so just keep your hand on your lower back as you go down and up. You want to show me?
Sure. Okay. So just like that? Is that right?
Yeah.
Can you see?
Yep. Just make sure your hand stays on your lower back.
So just down like that?
Yep. Good job. Notice how your core is tight and your back stays straight.
Mm-hmm.
Alright, so I'm going to teach you a lift today to hopefully alleviate some of that pain in your lower back. It's called the Stoop Lift. And this is going to be used for something that's a little bit off the ground. It's like a suitcase or a backpack or like grocery sacks that are off the ground. So you don't need to go into full squat, it's just a stoop lift. Alright, so what we're going to do is you're going to go and stand next to the object that is going to be lifted. Your feet shoulder width apart. You can either put them side by side like that, or you can stagger them a little bit, one in front of the other, next to the object. So stoop down, keeping your back straight, what we just practiced with the cane. Pick up the object with an extended arm and come back up. Make sure that when you come back up, your legs are doing the lifting, not your back. Alright, so I'll show you how to do it. So you're going to come up next to your object, shoulder width apart, throw your feet. Keep your arm outstretched. You're going to squat down, keeping your back straight. Grab the object and come back up. If you need to take the object anywhere, make sure that you aren't twisting like this. And then to put it back down, you're going to do the exact same thing. Set it back down. Alright, do you have any questions?
I don't think so.
Okay, can you repeat back to me the steps I just went over?
Yeah, so I just want to keep my spine neutral, right?
Mm-hmm.
Abs tight. Feet shoulder width apart. I'm just going to stoop down like that, pick it up.
Yeah.
Is that it?
Alright, do you feel safe to try this?
Yeah, I'm Chuck
Alright.
Norris, I think so.
Okay, go ahead and demonstrate what you can do it for me.
So, I can stagger my feet?
Yeah,
Is that
stagger
right?
your feet or you can put it
Okay.
next to you.
Because that feels more natural like that, so I think
Okay.
I'll probably do that. So, I'm just going to keep it straight like that, pick it up
Good job. And set it back down.
same way.
There you go, perfect.
Alright.
And here's the handout that I made for you. You can take this home and practice. And it has the steps to do the lift. And then down here, just remember to keep your core tight, your back straight, and lift with your legs.
That's a good reminder.
Alright, do you have any more questions for me?
Mm-hmm.
Okay, thanks for coming in.
Thank you.